there are so many avenues to express what's happening at the preconscious level that is related to writing, to the arts, poetry. We have here in our community a wonderful man who is a lawyer and has been through so much in his life, and just came here very vulnerable, and he uses songwriting, which is wonderful. When Stan and I were working with dying cancer patients in the 70s, we would have our patients, if they wished to, make mandalas. In other words, we'd give them crayons and colored pencils and oil pastels, or whatever, and have pieces of paper, and to have them draw out their experience. Haiku is a wonderful medium because it's like, a drop of gold. It's not the whole gold bar. Poetry, whether it's being composed or whether it's being shared, you as a caregiver can sit with a patient, as I have many times, and not offer a tragic or morbid poem. Some of my favorites, it's like tickling into the moment. There's a kind of, so you have this kind of E.E. Cummings connection. Another one is to hand your patient a little camera and have them record, take photographs of what's important to them. Providing a non-linear means for people at the end of life who are, still wakeful and have got a kind of creative juice where they want to express what's happening, but they don't have necessarily the regular words, or are reticent to share in a conceptual way or diagnostic or therapeutic way. It's really important. And this got stirred up for me, I have to say, in the work that Stan and I did, in the early 70s. In the drawing of these people who were dying of cancer. It was so really revelatory. And no matter how crude the drawings were, again, what I said earlier is the sense of appreciation that someone is stepping out of this obsessive, completely justified self-concern about managing their own somatic affective journey as they move into the final phase of their life. But allowing people a creative outlet and expression that is shareable is very important. One of the most transformative experiences that I had during COVID, where I was bearing witness to the grief and the moral suffering of caregivers all over the world who were just bewildered, is I began to paint. And it was so, it brought me into a completely different state of flow. And it was just this huge resource for me. So, bringing that into the team or the family system and into your individual life, I think is really wonderful.